Can biomarkers help measure post-stroke fatigue? Imagine trying to understand a complex puzzle where many pieces are missing. That's similar to what scientists face when trying to measure post-stroke fatigue. It's a common and often debilitating feeling of exhaustion that can linger long after a stroke. Researchers are exploring whether biomarkers, which are measurable indicators of biological processes, can help us better understand and assess this fatigue. But right now, the answer is not straightforward. Biomarkers are promising tools because they could provide objective ways to evaluate fatigue, which is usually assessed through patient reports and clinical scales. For example, electromyography, or EMG, measures electrical activity in muscles. It can help identify muscle fatigue by showing how muscles respond during activity. In stroke survivors, EMG studies have found altered patterns, like lower muscle activation on the affected side and increased effort needed to keep muscles working. These patterns suggest that central fatigue, or fatigue originating in the nervous system, plays a role in post-stroke fatigue. On a molecular level, scientists are investigating blood-based markers such as glucose levels, uric acid, homocysteine, and thyroid hormones. Some studies have found links between these markers and fatigue severity or recovery outcomes after stroke. However, none of these markers are specific enough to be used routinely in clinics yet. The challenge is that fatigue often overlaps with depression, stress, and other systemic factors, which share similar biological pathways and biomarkers. This overlap makes it difficult to identify a single, reliable biomarker that can definitively measure post-stroke fatigue. Neuroimaging techniques like magnetic resonance imaging have also been explored. Researchers look at brain scans to see if certain areas or lesions are associated with fatigue. While some preliminary findings suggest possible connections, these are still in the early stages and requiring more validation before they can be used clinically. In summary, many potential biomarkers have been identified that relate to post-stroke fatigue, but none have yet been validated for routine use. The complexity of post-stroke fatigue, affected by brain changes, psychological health, and overall physical condition, means that a combination of biomarkers along with thorough clinical assessments is likely the best approach. Currently, healthcare providers relying on clinical scales, along with evaluations of mood, sleep, and physical function, to understand and manage fatigue. As research continues, the hope is that more objective, reliable biomarkers will emerge to help tailor treatments and improve recovery for stroke survivors experiencing fatigue. Always remember, each person's experience with post-stroke fatigue is unique. It's important to work closely with healthcare professionals who can provide personalized advice and care. Biomarker research is promising, but it's just one piece of the puzzle in understanding and managing this challenging condition.